Kaduna State is a state in northwest Nigeria. The state capital is its namesake, the city of Kaduna, the 8th largest city in the country as of 2006 population census. The state has 23 local governments, with its population currently estimated at about 8.2 million inhabitants, based on the National Population Commission projected annual growth rate of 3.18%. The National Bureau of Statistics report on poverty and equality in Nigeria shows that 43.5% of the population are poor and vulnerable. Similarly, the dependent population is said to be 48%, consisting of people less than 15 years of age and those over 64 years. More often than not, majority of households in Kaduna State do not have coping mechanisms for shocks such as increase in price of food items, sickness, disability and death, as well as departure of working household member. This unsavory scenario continues to impact negatively on the development of the state, a situation that has prompted the state to take actions and institute social protection programs to reverse the ugly trend of individual and household poverty and bring about improvements in the lives of the state's poorest and most deprived households.
By virtue of why we have government according to our constitution, which is the security and welfare of the people, that's section 14. If you look at the size of the GDP of Kaduna State, the infrastructure, the economy as a whole, and even the revenue base, there is very not much that can cater for the rising population, which is at about 3% or so. So it means that poverty would be very, very high.
All over the world, social protection has risen to become a key policy measure on the agenda of the government to bring succor to the poor and vulnerable citizens.
Social protection is a relatively new concept. But if we look back, social protection has existed in Nigeria as far back as Nigeria has existed. MAMSA was social protection. Better Life for Rural Women was social protection. The Green Revolution was social protection. All of these are social protection, but they were all targeted at people across various phases of the life cycle. Absolutely anybody may get to a situation whereby they need the state to play its responsibility to the citizens, what will sociologists or other people will call the social contract that the state has with its citizens.
Social protection is therefore defined as a mix of policies and programs designed for individuals and households throughout the life cycle to prevent and reduce poverty and socioeconomic shocks by promoting and enhancing livelihoods and a life of dignity.
Social protection has been proven to work in several parts of the world where it has been implemented in South Africa, in Brazil, for example, to help lift people out of poverty. And so it was felt that, it's time for people to begin to get some kind of support, some kind of safety net that allows them to live a life of dignity.
In Nigeria, the government has introduced several social protection programs to address poverty and help reduce the high rate of unemployment in the country. These include the National Homegrown School Feeding Program, the National Cash Transfer Program, and the Graduate Empowerment Scheme and Job Creation Project, NPAR, as well as the Government Enterprise and Empowerment Program.
The National Social Safety Net Coordinating Office is a key partner. The National Cash Transfer Program is a key partner as well, implementing social protection programs. CDGP is basically using the expertise that we acquired over the 7 or so years we implemented the cash transfers in Jigawa and Zamfara to help strengthen the National Cash Transfer Program.
To replicate the efforts of government at the federal level to reduce poverty among the populace, governments at state levels are embracing social protection programs to alleviate the hardship faced by the poor and vulnerable, especially those made worse by the COVID-19 pandemic.
Nobody expected that 2020 will be the year that happened, people who had funds were able to go and tap from those funds and say, okay, how do we help businesses that have crumbled because of COVID? How do we help individuals who cannot earn a living because of COVID? So this is an eye-opener, and it has shown us that social protection is very important, and that serious governments need to take it seriously.
So before now, of course, Kaduna State had been providing skeletally and well uncoordinated some social protection programs.
But a key issue that you should note was that most of these were fragmented and piecemeal. So there was no specific attempt to bring them together or to create linkages. And for most of them, they became like one-off programs. So it's implemented. After it's done, maybe there's a transition in government, the program goes quiet and nothing follows on to that.
We started by mapping out the existing social protection interventions in Kaduna State per MDA. We realized that they are doing bouts of social protection interventions in the state, but it was not coordinated. It was spread across different MDAs. Now, the first thing we did was to establish a state steering committee that would coordinate all of these social protection interventions.
What we quickly do is to do a very good advocacy to the state government for them to see the need of having a social protection policy for the state, which of course we have a very good, we're able to generate that political will, and then the state government asked us and they are willing to have that social protection policy.
To this end, Kaduna State, as one of the CDGP2 focal states, alongside Kano, Jigawa and Zamfara, is piloting social protection programs and policies in the state to ensure citizens of the state have access to basic needs of life as a right.
In a lot of countries, it's enshrined in their constitutions. The right to water, the right to a decent standard of living, the right to food, good quality education. People have a right to a decent life. People can eat, they can attain their full potential. They don't have to bankrupt themselves if they fall ill.
Poverty is getting deeper. We are just coming out from our second recession as a nation, and anytime you hear recession, it means more people have gone into poverty. A lot of people that have lost their jobs. Government needs to urgently work around supporting and protecting these people in order for them to live dignified lives.
We have to work hard to protect those that are unable to feed, those that are unable to even visit the hospitals because of lack. And that's the reason why it is important to see how we can protect the less privileged.
Advanced societies, like we've seen in Europe, in America, they've set up their systems that hedge them against risks, that hedge them against shocks. And that's why you see the inequality rate is far less in Western societies. But here, the disparities are huge. Those who are rich are very rich. Those who are poor are stinkingly poor. And that's why this is critical for us, because these are ways that we can mitigate through policies, through actions, through programs to ensure that that gap is closed up a bit more.
The CDGP2 is working to strengthen the demand and supply sides of social protection services. This way, citizens are able to understand and seek social protection services from the government. Similarly, the government is able to understand the demands from the citizens and provide such services to reduce poverty in the state, especially among the poor and vulnerable.
As a program, I feel there was a significant contribution in increasing awareness, understanding, and also support. Social protection is a difficult area. So most people will tell you it's a waste of resources. Maybe it makes people lazy. It's not an economic investment. So for a long time also, in most states, it was not a priority. So by increasing that understanding, awareness, there was also an increase in support. So I think that was a very powerful impact. And that led now to states starting to engage into social protection and starting to think about long-term strategies and plans for implementing programs.
Since 2013, with funding from the UK's Department for International Development, DFID, Save the Children, along with action against hunger, have been at the forefront of supporting Nigerian federal and state governments to develop evidence on nutrition-sensitive social protection and to establish effective social protection schemes and systems. Initially implemented as pilot maternal and child cash transfer program 2013 to 2019,
Nigeria has some of the poorest health and nutrition indices. Jigawa State had very bad stunting rates, and same with Zamfara. So the CDGD program then was part of the then DFID's approach to supporting the Nigerian government to improve uptake of optimal nutritional behaviors and practices in the state.
That was the initial phase one of the project. And mothers were provided with a stipend of about 3,000 naira, and later it was increased to around 4,000 naira every month, while they had the liberty to spend the money as they wanted. We also provided them with education to let them understand the importance of proper nutrition to themselves and their children.
So when the program came in, there was that dual focus. So the heavy focus was on addressing malnutrition using social protection, but also trying to create that awareness and build that momentum to allow the states to now invest into their own social protection programs.
We realized that after 6 years of implementing that program, a number of women had started livelihood activities which they didn't have before. And that wasn't part of the initial design of the program. It was something that as time went by and they started saving, they realized that they could use that money to enhance their own livelihood by engaging in productive activities like rearing animals, buying grinding machines, and so on.
Because of the impact that the program has made, that is what has led to the second phase of the program.
And so with the support of FCDO, we moved on to Kano and Kaduna, and we started to engage more collaboratively with the National Social Investment Office that has now transited into the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development.
With support of the Foreign Commonwealth Development Office (FCDO) through CDGP Phase 2, Government of Kaduna State is working to lift a sizable number of poor residents out of poverty by 2030, in line with Sustainable Development Goals (SDGs). The state has taken deliberate steps to provide support for the poor and vulnerable households to strengthen their resilience to shocks and ensure everyone is able to access income that provides security throughout a lifetime.
So we've seen the institutions improve. So the policies being set up, the legislation being drafted, and programs being introduced. So this just shows us that social protection has gone up the ladder of government prioritization of programs.
The state is working with the CDGP to help increase public awareness on social protection with great emphasis on inclusiveness, which gives special attention to children, women, elderly, and persons with disability.
Inclusion is important because no one wants to be left behind. We all want to feel like a part of the society. We all want to have a sense of responsibility.
What we try to do is to ensure that the rights of people with disabilities are protected. As I also tell you, mainstream. If there's any intervention for the vulnerable groups, as far as healthcare service delivery is concerned, are they gaining access to that intervention? The same thing with education, the same thing with other social rights.
The CDGP program in Kaduna State is also providing technical support to institutions and systems to enable timely and appropriate response to citizens' needs when in shocks. This includes technical capacity building among civil servants, civil societies, and state actors to ensure increased knowledge and the provision of focused technical support on areas such as reporting and monitoring mechanisms and ways to create fiscal space for increased investment in social protection.
The support they have provided for us has allowed us move much faster and break through the bureaucratic bottlenecks than we would have if we did it on our own and went through the normal government processes. So thanks to CGP, for getting Kaduna State to where it is today in the area of social protection.
They are working with some of the NGOs, particularly when it comes to sensitization about the social protection policy, and also sensitizing the citizens on the social register and on the need for everybody to be aware of what is taking place.
For CDGP, at the level of CSOs, we will say that they've really brought out an innovative system strengthening mechanism for us to implement social protection activities in Kaduna State.
They have pulled us together under the Kaduna Social Protection Accountability Coalition, where they have trained us. Initially, we had very vague understanding of what social protection is.
So, and also we're able to also build the capacity of the stakeholders, the ministries and MDS also, to be able to implement the social protection programs that is within their ministries and MDS effectively.
We provided the technical expertise to support the state government to develop the social protection policy. We conducted key informants interviews for identified stakeholders. We conducted focus group discussion at local government levels. We had youth groups. We had representatives from the community of people with disability. We had representatives of the women group. We had representatives of ethnic minority groups. And CDGP led all of these processes. And when I say led, we provided the technical expertise for all of this to happen.
To this end, the government of Kaduna State, with support from CDGP, introduced social protection policy, which reflects the state government's commitment to inclusive governance that leaves no one behind, regardless of culture, ethnic, religious or partisan affiliations, but provides equal opportunity for residents to live productive and dignifying lives.
It is on this note, I hereby launch this policy to the glory of God, to the benefit of humanity and the good people of Kaduna State. Thank you and God bless you.
Social protection has become a paramount public policy objective designed to respond to the consequences of social and economic challenges. Every day, the plight of the poor and vulnerable in the society calls for an urgent response that is both innovative and proactive by building systems of social protection with the capacity to adequately prevent or at least mitigate more of the citizens falling into poverty.
With the social protection policy, we believe that a lot of things will be covered, such as health, such as education, security, which is very important. We believe that by the time we make all these provisions, we're looking at a healthy, educated, well-protected society.
Part of the things we're doing is also sensitizing the people to let them know this is your right. It is not favor, it's not government handouts. So that when another person comes and says, hey, you people are not entitled, then they can stand up and say, no, we've been benefiting this, we deserve this.
In the education sectors, the Kaduna State government has demonstrated commitment to improving access and quality of education through a number of programs and policies, such as free education in public primary and secondary schools, the school feeding program, free uniforms for pupils, and the girl child education program, amongst others.
Today, we have free compulsory primary and secondary education. Before it was for girls, but now it has covered everybody, including the boys.
Our state is like one of the first in the north to make free and compulsory education for 12 years. That is the first 6 years of primary education and 6 years of secondary education. We're the first to initiate a scholarship for disability, for people living with disability.
MDAs are now conscious of the disability issues. So whatever they are doing, they usually contact us and tell us that we are going to do a certain program. We want, how can your people benefit from it?
We've also tried to create linkages between agencies. So we're not just sitting and say, okay, see, federal government is providing funding, we're running these programs in the state. We're looking at how to integrate, for instance, the cash transfer beneficiaries to our business innovation and technology ministry to provide them with skills.
We also have the health insurance scheme, which is covering the most vulnerable. We don't want them to be begging on the street, and want to provide an enabling environment for them also, like any other person in Kaduna State.
Conditional cash transfer in Kaduna State, we started it in 2017 with pilot local government. There's 9 local government first. We have 34,646 beneficiaries. So it's later on scaled to the other 14 local governments. For the selection, it's been done by one of our sister units, that's SOCO.
SOCO is acronym for State Operations and Coordinating Unit. Our primary responsibility or mandate is for the population of the social register. Everyone whose name is on the register is actually identified by their own community.
We're working and identifying people at the local government. Because we have the social register now.
The social register is the primary source of data for any poor and vulnerable, intervention or program that is going to be run in the state.
A lot of our interventions are geared towards empowering the woman. Because when you empower a woman, you empower the whole family. So we came up with the Kaduna State Women Empowerment Fund. And gracious enough, His Excellency the Governor approved the sum of 200 million naira for the women.
Before I was buying like 1, 2, 3 bags, but when I got the loan, I bought maize, 5 bags, guinea corn, 2 bags, millet, and soya bean. I then rented a shop and start selling the grains there. I employed 1 sales girl. Now I have savings in the bank.
Before the cash swap, I was into petty trading. I sell firewood and I make soap at home and sales. So when the cash swap come in, and from there I started a pottery business. So I'm still doing that business and I joined the pottery business into it.
At the end of that exercise, we were able to reach about 7,000 that benefited from that card swap. And then also we got about 16,000 women opening an account for the first time.
The social protection policy of the state is inclusive, robust, realistic, and is intended to spur a well-coordinated social protection system with the intention that no citizen falls below the minimum level of social and economic well-being. The government believes that a progressive society must provide tools and the environment for its citizens to exercise their rights to attain full potentials.
In our 2021 budget, we have allocated 1% of our IGL to make sure the less privileged are taken care of. That's how committed the government is, making sure that our vulnerable people in the state are taken care of.
So seeing social protection captured in the 2021 budget to the total amount of about 400 million, it shows that there is commitment in Kaduna State for funding social protection interventions. One of the key functions of social protection is creating that strong relationship between citizens and government. In most cases, it's the first point of contact that a person can see to say the government is providing for me as a citizen, and I can feel a relationship with my government.
But more importantly, it is the awareness of social protection and the importance of social protection by decision makers, by the people.
People don't know it's their right for governments to provide for them. And civil society organizations are in the best position to raise awareness amongst the vast majority of people as to the need for social protection.
There's increased awareness at the highest levels of government. We've also cascaded down to the lowest levels, even to communities, to people, thanks to our CSOs who are working with us. We've tried to put it up front to go and sensitize people, let them understand what we're trying to do.
We want to see that linkage in terms of service delivery and ensuring that shock responsiveness to risk and vulnerability is addressed using the social protection policy.
The overarching goal is to scale up the state's social protection activities to ensure that the poor and most vulnerable residents of the state are supported to live productive, fulfilling, and dignifying lives. Therefore, social protection intervention programs and activities in Kaduna State will henceforth be designed to progressively remove or prevent residents' exposure to shocks that could force them into extreme poverty.
Social protection, as emphasized, should not only just be for poor and vulnerable people, it should cover every stage of the life cycle. At this stage, for today, I might not need social protection because I have a decent job, I have a good education, and all that I want. But then I don't know what the future holds for me, and I might encounter the vicissitude of life in the near future and puts me in a situation whereby I'm unable to afford things I take for granted today. Should that such a situation arise, that's where the state steps in.
So this is not necessarily just for the poor and the vulnerable, but also those that are very susceptible to shocks. People that are working in the informal sector, they do have money, but if anything happens, quickly they fall into poverty.
It is the desire of Kaduna State, as indicated in its policy on social protection, to establish a social protection agency which will holistically work to facilitate the smooth execution of the various programs, manage overlaps that may exist, and drive home the social protection policy in the state.
So one, we want to have the law, social protection law, which provides the entire framework for how social protection will be administered in the state. And once that's done, we want an agency that oversees all social protection activities so it's coordinated.
It's like a one-stop shop where if you need any information on social protection, you go there, you get it.
We believe that we're on the right track, putting people first as the vision of this present administration, and ensuring that we invest in our people.
If this must succeed, then it is not only the responsibility of government. We need to see the private sector. Where are they putting their corporate social responsibilities, all those funds? If you look at the implementation plan, there's already talking about a trust fund where all these funds can come in. So that's what I want to see.
With an implementation plan in place, it is expected it to guide social protection policy delivery and support the realization of the laudable social protection objectives of the state in a timely, cost-effective, and realistic manner.
The way we are going, if we continue like that, in the next few years, I see Kaduna almost eradicating poverty in the state, eradicating hunger in the state. That's my wish, and that's what I want to believe will happen in Kaduna State.